Premier Heating and Air has rebates on new units starting at $1,000. Indoor air quality products are free with the purchase of a new unit, and all types of financing are available for new units and for repairs. Premier Heating and Air, a locally owned and operated company. Log on to dublin.premierishere.com or call 478-300-2633. And for a limited time only, enjoy a one-time exclusive offer for new customers with our dispatch fee waived on your next repair. So call or log on today. Premier is here. And welcome into the studios. We have Dr. John Souza now. So many people from the community, John, are going to recognize you. You have been a part of our community for many years now. And today we want to have you come in and be able to speak to us during our special this month on aging Americans, on urgent care, or specifically on your business, which is Med Plus Immediate Care. And that's over on Hillcrest. I know a lot of people use you, John, as far as their medical provider. First of all, welcome to you.
Oh, thank you.
Yeah. So, John, how long you been in our community?
About 30 years.
Wow.
Yeah.
Yeah. Yeah. You came here and as obviously a doctor, but what did you do when you first came?
Well, when I first came, I practiced general surgery over at Fairview Park Hospital.
Okay.
And also surgery at the VA hospital as well.
Uh-huh. Yeah, I can remember that. That kept you pretty busy right there, didn't
Oh
it?
yeah, definitely.
Yeah, great experience, right?
Yeah, it was a great experience, and it was a good way to integrate into the community.
Mm-hmm. Yeah. You know a lot of people know you, and that's really transferred into some good opportunities for you to serve a lot of people in our community.
Right, definitely.
You've had an urgent type care business for many years as well, haven't you?
About 15 years, actually 17, I guess, since 2008.
Yeah. So maybe 20 years or so ago, John, that's when we really started to see an insurgence or to be more common to have an immediate care or urgent care.
Right, and I think that development kind of parallels with the progressive development of short supply of doctors. So in other words, the urgent cares are really market driven because people need access, and access over the years has become more and more difficult to get to your primary care doctor for other than routine scheduled visits.
Yeah, yeah. Immediate urgent, I mean, it's right there for you. You don't have to have an appointment in most situations.
Right, you can just walk in, and that's when people have problems that need immediate attention, the choice is either to go to the emergency room or come and see us.
Yeah.
So they naturally want to come and see us if they can because of the convenience, and the cost is much less.
Yeah, yeah, and two, if it's not a dire emergency, if you're not bleeding, and even at that, I'm sure you could help many people. But if you don't have just a severe injury, if it's not an emergency, then
right.
It makes sense.
And sometimes people don't know. Sometimes people come when they have emergencies that really need to be at the hospital, and we pack them up and send them there, and stabilize them and get them on over there to the hospital.
Yeah, yeah. It's all about the staff you have too, isn't it?
It is. It's a customer service driven business and service, and people that need immediate attention, they want to go to a place that's friendly and kind and try to to meet their needs. And I think my staff does a great job. I think as far as being able to serve the community, they're very responsive and attentive to the people that come to our clinic.
You have several locations, don't you?
We do. We have actually 4, one in Macon, one in Eastman, one in Milledgeville, and of course the one here in Dublin on Hillcrest.
Yeah, that doesn't spread you too thin. You got a good staff at each one, don't you?
We do. We have about 70 employees, and wow. we have the bases pretty well covered.
Mm-hmm. Yeah. In looking at health care, it's changed a lot in the 30 years plus that you've been a part of it, hasn't it?
It has, and I think there are a lot of reasons for that. I think we kind of joke about it, but we refer to this thing called Dr. Google. People get online and they read and they find, they realize that they have something that's potentially serious. And so instead of just sitting at home and not doing anything, they show up and say, hey, I've got this and this and this, and it could be this. And oftentimes they're in the ballpark on what we would be thinking about. So it's not as much as doctors would want to kind of disparage the modern patient who's a little bit educated on things. it's actually a positive thing because you can have a little bit more of a in-depth conversation about what the situation is and what options are and so forth. And so it's
Well, you
not
know,
a
that's
necessarily-
encouraging, John, because so many times a doctor, you'll go to them and they discount what you're saying, but obviously we know our body better than anyone else would, and we know what we're dealing with, and maybe with a little research from, somebody with, with a little sense to them at least.
It really helps more than it hurts, although it just irritates the old school doctors like I'm the doctor and you're the patient.
Yeah.
But I think the modern way is that, and I'm thinking especially in a market-driven healthcare business like mine, we want to be attentive to patients' needs, we want to be attentive to their expectations, and we want to incorporate their views and their attitudes and their concerns in the process of figuring out what the options are and what the best way to go as far as a treatment plan.
Yeah.
So,
Yeah, you do more than just treat patients that come in. You do physicals for government agencies, things like that too,
that's
don't
right.
you?
That's right.
Yeah.
And we do, a little bit of occupational medicine, which means the workers' comp, and it means the people who need a CDL, a medical certificate to drive a truck, and things like that. So we do those things alongside of doing just the urgent care stuff. Of course, we do some primary care as well.
Yeah, yeah. What ages do you serve?
Well, we kind of joke about from the cradle to the grave. I mean, we, and that's where we're kind of old school. The modern urgent cares are very particular now. A lot of them won't take care of, people below a certain age or people who are above a certain age and have all these rules. But I mean, we're a small community. We know everybody here. Everybody knows us. And within reason, we try to take care of everybody.
Yeah.
And get, oftentimes we're in urgent care, we're kind of a traffic director for people that need access to a higher level of care but can't get to it without an intermediate like us. Just for example, suppose that, you had got concerned about something and you wanted to see a neurologist. Well, you can't just pick up the phone and go see a neurologist.
Right.
They're 2 or 3 months behind on booking appointments, and they won't accept referrals without a referral from another physician. So we do a lot of referrals to people come in who just come in solely for the purpose of getting a referral to a specialist for some particular need.
Yeah. Quite understandable.
Yeah, and that's just, and it's another symptom or manifestation of the doctor shortage. I mean, we have the doctor shortage now is bigger than it's ever been. And, you see where that the federal government has recently kind of opened the door to international recruiting and offering visas, J-1 visas, work visas for physicians to come here and work because we don't have enough doctors here. And urgent care is, one of the short-term answers to access for people because we don't have enough physicians to take care of everybody.
So why do we not have enough doctors?
Well, that's a complex answer to give, and I think there are a number of things that contribute to that. One is that healthcare has evolved into a profession that's got a lot less autonomy and freedom than it had at one time. And I think that a lot of people, the creative minds and so forth that often go into healthcare, think that's important. And they, if you're in a situation where that everything is dictated to you and kind of like a cookbook, roadmap, blueprint type of thing, then it's not as challenging and not as interesting for somebody who wants to pursue something where that, there's a balance between the artistic side and the hard science side of healthcare. So that's one thing. Other thing is, frankly, too, is that there's just so many other opportunities that for young people these days to make a better income, make a better living than they can make as a physician, and not have all the extra responsibilities, the call, being up at night, taking call, and the work hours and all those things. So young people these days don't really embrace the level of commitment that we once saw from healthcare physicians and also a lot of other professionals as well, where they really to work a 7 or 8 hour week was just, people wouldn't bat an eye at that, but modern people don't want to do that.
Yeah, young people coming out of college now, you hear it, and I understand that totally because I hear it from, they're just not going to marry that job. They're just not going to, it's not going to hone them.
I mean, the work-life balance was not a phrase in our vocabulary, but now, I mean, my kids said, I'm like, what?
Yeah.
I mean, we used to say pay your dues. Now we're talking about a work-life balance.
Yeah, right off the bat.
So it's like, well, and I don't know, I mean, philosophically, as an older person in our society, I don't know if this negatively impacts healthcare. It's a trade-off. Over the years, we have saw less and less of a, we certainly say it another, we've saw the level of commitment to patients in terms of the doctor's availability. It's decreased over time. Like, for example, one time doctors used to go to the hospital and also be in the office. Nobody does that anymore because it's not very efficient from a business standpoint. It made for great patient care because you got to see your doctor when you're in the hospital. Now you go to the hospital and you see whoever's there, and they don't know you, and they take care of you. And there's some value in having people that actually know you and know how to navigate through some of these difficult situations. The jury's still out on, and time will tell whether or not that's really been adverse or whether it's been better. In some ways, it could be better because, frankly, hospital work is especially now. In other words, it's gotten so advanced that it's really difficult to be the best at everything. In other words, it's trying to be able to take care of people in an ambulatory setting in the clinic versus trying to take care of people in the hospital. They're different skill sets, and so I don't know that it's necessarily a bad thing. Time will tell, but we definitely have seen over the years that healthcare providers, like other professionals, now want more free time, more of a better quality of life, and they have decreased their level of commitment to their patients. I don't know how else to say it but that. Not intentionally, that's not their goal, but they have, their level of commitment has been, it's become more like a contractual business relationship now than it was a relationship in the past.
Yeah.
I haven't abandoned that old model myself, but I mean, it's just, that's just how it is become. And it's going to become more so. So, that's, now we're looking at AI infiltrating healthcare. That's coming down the road. And that's, I have mixed feelings about that because a lot of times when you put all the data into a system like that, then a lot of times you can get a better analysis and make a better decision about what to do versus us, doing things based purely on our own guesswork and our own knowledge, which is limited. I mean, when you put everything into a computer and give it the information, then oftentimes it can come up with an answer that, from a statistical probability, is going to be a better answer as far as which way to go, whether to have surgery or not have surgery, whether to take this medicine or not take this medicine, all that kind of stuff.
It'll at least narrow the scope.
Narrows it down, but we have to fight through all this to try to preserve the doctor-patient relationship and that connection we have and the trust, because those are really important things. I always joke about in healthcare that we're always so quick to take credit for when something goes right, but the reality is God heals most people. People get well in spite of what we do, oftentimes not because of what we do. Yeah. But there are basic things, somebody has a wound that, or has a cut, and you sew it up, you fix it up, and then God heals it. So, the changes we're going through right now, it's anybody's guess about whether it's going to be better or worse. But it's here. We have to somewhat embrace it because it's here. And urgent care operations, the realities of doctor shortages, those are modern realities, and young people love it.
Sure.
And I think that the elderly folks find it beneficial too because they can't go see their doctors without advance notice.
Sure.
And they don't want to go to the hospital. So hospital is a great place to be.
If you need to be there.
If you have a bad injury or you have an emergency, that's the place to be. But it's not the place to be if you have a sore throat or a headache, that's minor, or a little tummy ache or a rash. I mean, I think I've said this to you before, going to the hospital for a minor problem, that's like going to the airport to buy a hamburger. Nobody goes to the airport to buy a hamburger. Why? Because it costs about 3 times as much at the airport as it does anywhere else.
Sure.
But if you go to the ER for a minor medical problem, that's the equivalent of going to the airport to buy a hamburger.
Yeah.
You got to pay a premium.
Yeah, good analogy. Yeah. We'll take a short break and be right back.
Hi, I'm Greg Carter with Shamrock Honda Kawasaki CF Moto. Come check out our full lineup of ATVs, side-by-sides, and motorcycles. We serve Dublin, Lawrence, and Central Georgia areas, and we'd love to serve you.
Hi, I'm Lily Rose Barton, and I have been coming to Bass for years. I had to come for knee replacement recovery. I had a bad back, I came for that. But this last stint was because I had SI joint fusion, and my right leg was very weak. Muscles were weak, but they have really built me up, and it has really helped. All of them, Erica, Whitney, Chuck, they all are just so good at encouraging you to do what you can, but don't overdo. Take it slow and easy. And taking it slow and easy has got me where I am today. From the front door to the back, they're all just very, very nice and helpful. And I appreciate all of them so much. I just can't express with words what they mean to me. But I do hope they know that I appreciate everything they've done for me through the years, not just since January when I started with this one. Chuck took me in. I brought the doctor's report from that. He put it in the computer. He studied what needed to be done. He instructed me how to do it, but he was right there every step of the way that first day. Not only do I do this, but when I get in the anti-gravity walking, at first, yes, I was scared because I hadn't been able to walk that much, but I have come a long ways. So it's just been such a blessing to have Bass to be able to come and do this therapy with them. And they're just so good to all their patients. But I feel like they've been especially good to me, and I do appreciate them. I would highly suggest that if your doctor were to suggest therapy for you, please tell them Bass in Dublin, Georgia is where you want to go. Any of them here will just be happy to work with you and get you back on your feet and able to do things that you were not able to do before coming to Bass therapy.
All right, back with Dr. John Souza, and you offer a lot of services at Immediate Care. You see a lot of different patients, and a lot of people may be under a misconception about urgent care. You take insurance just like anyone, right?
Right, that's right.
Or you take private pay just like anyone.
That's right.
Do you turn anyone away?
Generally, no. Only the unruly ones.
Well, you don't want to see them come.
Yeah.
Yeah.
But you're right. We do take the full spectrum of payment to people. We don't, and somebody comes in and needs medical attention, even if they don't have the means to pay. Then if they need attention, we're going to provide that to them. We don't turn people away who come to us with things that need immediate attention and not address them. We do have a good option for people who don't have health care insurance and have limited resources for health care. We have a couple of programs we call these Value Med programs. So these programs are designed for people who don't have insurance or have insurance where the deductible's high and they have to pay out of pocket. If you have a $5,000 or $6,000 deductible, that's effectively not even having insurance.
Right.
Because until you meet that deductible, you're still paying. So we have two plans. We have a plan for people who've never been to the clinic before, and we're trying to recruit them through an online program, promotional, and we allow people to become a member of the clinic for a price of $39 a month. They pay a $100 initiation fee and then $39 a month. And that allows them to access the clinic, to be treated by a physician or a nurse practitioner, allows them to have x-rays, allows them to have basic labs, and treatment, of course, and medications, injections, things like that. If they need them, all for that price. Now there are some things that are excluded just because of their cost prohibitive, but in basic packages, you get quite a bit of care for that $39 a month.
Yeah.
If you're already established with a clinic and you've been a patient in the clinic within the last year, then you qualify for another program where you pay $200 for the first visit, and then $100 for every visit after that. And so it caps the cost. So that means if you come in and get maybe $400 or $500 worth of services, you get blood work, you get x-rays, you get an EKG, and you get a medical visit, their total bill may be $400 or $500, but if you're on that plan, you're only going to pay $100 for that visit.
Yeah.
Because you bought the $200 sign-up deal. So that's a really, really efficient way for a person. If they supposedly average 4 visits a year, then they basically cap their cost at about $500 for their health care for the whole year.
Yeah, yeah.
You know, because and if they need you know, X-rays, blood work, and IV fluids, all that stuff, it's going to be included in that package.
Yeah,
Yeah.
yeah. That's a good opportunity for people now, Doctor.
It really is. It really is. It's not really well known, but we tell people when they come in and they're a cash payer, hey, if you want to sign up for this today, you're probably going to spend $200 anyway. Why don't you sign up, and then you're going to basically cap your future expenses at $100 per visit.
Yeah, yeah.
And,
people know their routine. They know about an average. A
Yeah,
lot do.
yeah, they do. Yeah.
I mean, our bodies are bodies. You know, we work in a rotation, and you know that I'm sure you've seen a ton of people who have allergy problems or some kind of a sinus infection from all the pollen.
That's right, and we're seeing a lot of that right now. So,
Yeah, a ton of it.
So we handle all those things, and there, you know, I think that for most people, there is no reason to sit at home when you're suffering because you're concerned about, you know, a big bill, or you're concerned about, you know, that you're
Yeah.
not going to be able to pay for it, because on our website, these programs are very transparent. They explain everything, how it works, what the costs are, and the person will find out that it's very manageable, very doable to be involved in one of those programs.
So there you are again. You're running. I mean, it's a business. Every doctor out there is running a business. Hospital running a business. Medical center, the VA. You're running a. You have to take care of business, or you're not going to be there.
That's right.
But at the same time, doctor, you're saying this is the compassionate side of you. This is the personal side of you that doesn't want to turn. Let's work out something, because it's not good to be sick. It's not good to have your health deteriorate.
That's right. And so when we first developed this business model for the Value Med program to help people, we tried to figure out what we could offer and how we could manage it in order to keep it viable so people could get care. But of course, we looked at all the things we had, and we eliminated. We have some things that we were doing that were very expensive in terms of our disposable supplies and in terms of our resources and so forth. And we said, okay, they don't need those. Those things are expensive, but they're not commonly needed things. People basically need, you know, access to X-rays, access to a provider, access to simple medications like antibiotic injections and medications like that. They need access to have wounds treated, minor sprains and lacerations and simple fractures and all that. And so all that can be offered under that program. And if long as we manage it well, then I think it can be a win-win for everybody.
Yeah, which is great information, doctor, because you don't know until you know. And when you're in a position where you're injured, or you've got an issue, and you go, and then you're on the other side of it saying, what is this? How do I afford this?
Well, it can be overwhelming.
Yeah.
It can be, and I'm kind of going through it with my own healthcare situation, and I'm having to pay for things that you would think the insurance would cover, but they don't cover, and so forth. And so if I have difficulty navigating, I can't imagine what the average person would think, because I know the system, and I still can't figure out a lot of times how to get through it without getting skinned. Getting fleeced pretty good. So.
Yeah. You mentioned earlier about a shortage of doctors, but a lot of people I talk to, especially older people in the community, will make the comments, we have so many doctors in our community. We have so many doctors, but most are specialists in some way, are they not?
Well, so we do have a fair number of specialists. Not nearly enough. I mean, we can talk about the deficit of specialists here, like we can talk about the lack of a neurologist. Ours retired last year. We only had one. We don't have a rheumatologist. Yeah. We don't have a vascular surgeon. We don't have a thoracic surgeon. We don't have, let's see, what else? We do have, on the other side, we do have a good ophthalmology here. We have good orthopedics here. We have good general surgery. There are some things we do very well, but there's a lot of stuff we don't have. But whether there's a shortage or not a shortage is really based on access. In other words, when a patient can call a physician and get in and be seen, within a reasonable amount of time for a particular problem. Like, I mean, just for example, okay, so a guy says, I think my gout's been flaring up again, off and on. And they call the doctor and they say, well, I can see you in a couple of weeks. Well, he may be able to wait a couple of weeks if that gout flare if it's not too bad, but suppose he can't even put his foot on the floor.
Sure.
Well, he needs something done today. Well, they can't, 3 weeks is not going to cut it. He needs to get a shot at steroids and an anti-inflammatory shot and some oral medication to settle that gout flare up down. And so you have 2 choices. You can go to the ER. They'll be glad to take care of it. But I suspect if you went to the ER for a gout flare-up and you got a couple injections, that might be a $1,500 bill. You know, $1,000, $1,500. That would not be out of line. In urgent care, that same treatment would be $150 to $200.
Wow.
Yeah, to do that.
Very common thing. You bring up gout for a lot of people.
Yeah, so those are things where that access, even people who are looking for a primary care doctor find that some of the doctors are full, they're not taking anybody anymore.
Right.
Or if you do try to get a scheduled appointment, it could be a long time out before you get an appointment. So I think those are really the things that we look at that really define whether you have an adequate supply of doctors or an inadequate supply is how reasonable the access is. And I think that's we're definitely, in terms of primary care, and even in terms of a number of specialists, we don't have enough access. We have GI medicine here, but it's limited. I mean, it takes months to get in for a GI appointment because we only have one GI guy. We've had as many as 3 in the past. When we had 3, it was pretty good. But when you're down to only having one guy, then it's hard to
Accessibility to them.
it's hard to meet the demand.
And they're not out there, especially for a smaller community. Is that
That's
true?
right. I mean, so I think that it is fair to say that there is some maldistribution of physicians across the country because a lot of people prefer to be more in a metropolitan area, an urban area, don't want to be in a rural area. We do have a little harder time recruiting people out to the more rural areas because they're find it more desirable to live in the city.
Sure.
I think that's a shame because it's pretty nice living out here in the country and a great place to raise a family and it's a great place to live and it's a different environment from what the city is. So, but that being said, I mean it's part of the access problem is a matter of maldistribution and again. There are people that, there's people that will go work in Savannah for less money because it's so nice to be close to the beach. And rural communities oftentimes don't have the resources to pay more money to make it more attractive for people to come. So that's probably a little bit of a flaw in our insurance and Medicare system that we should be paying more to people who are going out to these areas, incentivizing them to be there as opposed to, places, like the inner cities, as far as Medicare is concerned, and those places actually get more money for services than we get, which doesn't really make any sense.
Good point. Take another short break. We'll be right back, so you stay with us. Welcome to be back again. We're talking to Dr. John Souza. Insurance has changed drastically, hasn't it?
It has, and it was a little rocky transition in the beginning. I think that we kind of were trying to figure out once Obamacare came into effect what that would mean in terms of being a positive benefit for people. And initially, it was not that good. Not that it's a lot better now, but it's a little bit better now than it was at that time because I think with the changes the governor made within the exchange in Georgia and so forth, I think it's improved things a little bit. But having said that, we still have the situation where even though people can get an insurance policy for a fairly low price based on their income, there's still the problem that the deductibles are very high. And so basically, most people that get plans off of the exchange they're priced based on income, most people that get those are stuck with a pretty big deductible. You have the gold, silver, and the bronze, and I think the lowest deductible is maybe $3,000 or $4,000. The highest one's $7,000. And so effectively what you have with a exchange insurance policy is a policy that's going to offer you protection against a major medical event, like if you have to have surgery. So you may get a $100,000 bill, and you're out of pocket on that, maybe $10,000 or $20,000 or $30,000. But if you on a $100,000 bill, you're still going to owe $20,000 or $30,000 that you don't have. You know, so it's not really, and it doesn't really do enough to provide what people need the most, which is basic services. It's good to have a major medical policy, but most people, especially younger people and healthier people, don't need so much insurance for catastrophe. They need insurance just for the simple stuff, just for basic care, just for wellness visits and so forth. And so that really wasn't, when Obamacare was designed, it really wasn't factored into the process to make sure that people had access for the most basic care, like getting their diabetic medications and getting their doctor visits and their blood work for their diabetes and high blood pressure and all these other things. So it's kind of failed us in that regard. And the doctors don't get paid, the hospitals don't get paid well for providing care to a number of these insurance companies. In fact, a lot of doctors don't even participate in some of these plans because they pay so poorly that it's not worth participating in the plan.
Where do you see it headed?
Well, you know, I think there's room in the next couple of years for the present administration to make some improvements to Obamacare. They know now, I mean, Obamacare is probably not going to ever go away completely. But I think in the shakeout, I think that there's an opportunity to build on what's there and make it better, to create some better ways to provide entry-level care, basic care to individuals without costing a lot more money to the government. It's funny because I actually wrote a letter one time. I sent it to, it's been years ago. I sent a letter in to the President Trump in his first administration. I never heard back, but anyway, but the gist of the letter was that primary care as a unique problem in and of itself, people having access to just basic care, it's pretty easily fixed just by doing things a little bit different in terms of the tax process with healthcare providers and healthcare institutions. And so, for example, in primary care or even in specialty care, everybody out there in the past was subject to absorbing a pretty big chunk of uncompensated care. I mean, and as a surgeon, when I was practicing surgery, I wrote off at least $300,000 or $500,000 every year in uncompensated care. And people said, "Oh, well, you get a tax break for that." No, you don't. You don't get anything for that. Now, it's different in healthcare than it is in other businesses. I've had other businesses, and I provided services and I wasn't paid for my services, that was lost income because I provided a service and then I didn't get paid for that service. It lost income, and lost income was, my total income was offset by any income losses that I had where I was not paid for services. Of course, there were some real expenses in some of that stuff because you're providing, along with your service, and products and things. So bottom line is that, healthcare entities should be able to get a tax benefit from providing uncompensated care. I mean, and if they got 50 cents on the dollar or 40 cents on the dollar for every dollar of uncompensated care, I promise you that there would be hardly any provider in the country, any healthcare institution in the country that would not take care of those people, because healthcare entities, doctors and all the professionals, they all have a certain amount of income that needs to be, that's going to be taxed. And if they have some adjustments coming to providing indigent care, then that would just reduce their total tax bill. But of course, the response from the Democrats and the Republicans, "Oh, those greedy doctors, they should be, they make so much money, they should just suck it up." And well, I mean, in modern life, for many of us, the margin isn't like what it was in the past. It's really not. I get paid for a lot of insurance companies, and Medicare included, for services where that I actually pay me less money than it costs me to provide some of the services I'm doing. That's crazy. I mean, an EKG, which is, not, by today's standards, not super high technology, but an EKG is a pretty critical piece of information. And somebody comes in and you get an EKG and you read it and you make a decision, okay, this person could be having a heart attack, they're going to the hospital or whatever. They pay $8. Medicare pays me $8 to don't perform and read an EKG. I mean, it's insane. And the same thing is true for a number of other things. So to answer your question more directly about where healthcare is going, I think that the healthcare of the future, people are getting smarter. People are going to start buying some of their healthcare on their own and basically dealing directly with healthcare entities. That's why our program is it's kind of cutting edge doing the ValueMed program, because this allows people to come in and buy their healthcare, buy a membership. It's not insurance. It's clearly not insurance, but it's a opportunity for them to buy into a membership where they can have access to a certain set of things that they may or may not need, but if they need them, they're there. And so the future of healthcare, again, like it's always been, it's going to be market driven, and more people are going to be demanding these type of options. And it's happening now. I mean, more and more people are doing the same thing I'm doing. They have a name for the industry overall. They call it concierge care, or they call it subscription healthcare. Subscription is kind of like, you got a magazine subscription. Sure. You pay a monthly fee like a magazine subscription, and you got it. And so people, a lot of elderly people are buying the subscription program for concierge care. They contract with a doctor and pay X amount of money a year, and they get unlimited visits, and they get 4 regular visits, and they get whatever the package is that they put together. But this is a trend that's going to continue, and I think eventually what you'll see is that insurance companies they're already evolving towards being strictly a major medical policy, but they're going to eventually evolve that way because first of all, primary care needn't be excessively expensive anyway. I mean, an X-ray can be done. I can do X-rays all day long for $50 or $60 an X-ray and make okay money. So many of the things that we're doing, the actual costs are fairly nominal, fairly small, and then it's just our cost of administering whatever the shot or whatever it is, and we put that in.
We'll step away one more time. We'll be right back, so you stay with us.
If you're wondering when the best time to buy a new car is, it's right now. Hi, this is Don Carswell at Dublin Nissan in Dublin, Georgia, and the best day to buy a new car is every day. So whether you're looking at the all-new Murano, a brand new 2025 Versa, or you're looking for a great deal on a Z, we have all the choices here at Dublin Nissan every day. And now's the time to take advantage of all new discounted pricing on new Rogues and Pathfinders. We sell cars well every day at Dublin Nissan.
So, Doctor, people are living a lot longer these days. I guess the oldest person was this French lady, lived to be 122. That's exceptional. But there are centennials. There are people who are making it to 100 years old. What do you contribute that to?
Well, I think that definitely over the years, more and more awareness for dietary things and lifestyle health things are there. And but by the way, I mean we say people are living longer, but the last I guess 10 years ago we actually saw a little bit of a decline in overall as far as the average age of a person whenever they die. That declined a little bit. That's kind of maybe a little bit of an anomaly, but overall as a trajectory from say 1900 till now, yes, there's been a dramatic improvement in longevity owing to a better diet, better health awareness, and so things like that. And I think good healthcare, preventative healthcare is part of that too. Preventative medicine is an important part of healthcare, and I think that we, most of us out there are advocates to encourage people to get their checkups, to get their cancer screening, to get their cholesterol check, all those kind of things that we know that can, if we manage those early on, that can impact your life in the long run. We tend to a lot of times think only in terms of the things that are immediately dangerous to us, and not about the things that can, accumulate over time that can be adverse. And I think that we're trying to educate more and get people to understand that it's like, if your cholesterol is a little bit out of whack now, but it stays like that for 20 or 30 years, then you could end up with coronary artery disease, or you could end up with a stroke and things like that. So we want to be more proactive early on in trying to intervene.
Yeah. The stress on your body from things like cancer affects you. Stress on your body from illnesses or not knowing what you have wrong with you. That stress on the body is really damaging. We know that now.
It is, and we can kind of laugh about it. Maybe the young people are onto something because that part of their whole focus is trying to, keep their lives manageable and keep their lives where that they manage stress and that they have time off and this and that and the other, and those were not things that were on our mind. And I don't know, we don't know, how that over time that's going to affect our society in terms of longevity and in terms of a lot of other things, in terms of productivity and creativity and all the other things. And, we have, the older school of thinking has a little bit more passion about some of those things, but time will tell. But for sure, the trajectory over time has been increased longevity. And so that causes us to have to now to kind of begin to develop a more thorough way to deal with an aging population. So you hear, in the past we talked about gerontology, but now we have people who are dedicated to taking care of elderly folks that are somewhat mobile and healthy and just need to continue on with the kind of same preventative measures that we take for people at a younger age. So some countries, by the way, that have socialized medicine, they have kind of hard cutoffs. So like, for example, nobody gets a bypass past age 65 in Britain because their policy is if you're past 65, you're probably in too bad a health to survive a bypass anyway. That's probably evolved a little bit now until they may have raised the bar. Kind of like they raised the bar on Social Security now where you can't retire at 65. They got me set to retire, I think, at age 67 is my retirement age. And some people that are born later than us won't be able to retire until age 70. So, and that is consistent with the increased longevity and the overall general health of the population is improving with aging and the only thing that really is negatively affected the overall health of our population is obesity. And I think that's something that, there are a lot of aggressive campaigns now to really try to deal with obesity, with the GLP-1 inhibitor drugs, with gastric bypass, weight loss surgery, all these things out there that are available that are, trying to mitigate that problem because it's become, in our country, it's become a big problem. And Georgia's like one of the leaders. So,
right. Yeah. In looking at medicine, all you experience, doctor, why do you still practice medicine?
It's a interesting question to ask because I come from a family of doctors. My father is up in Atlanta. He's 95 years old, and he's I guess a second generation, third generation physician. His father was a surgeon and a founder of a medical school which my father attended in Paris, Brazil, and Belém, and so it's kind of in my blood. But I have a lot of conversations with my father about how far you go and when is it time to retire and how and it's like he's not a good person to ask that because he graduated from medical school when he was 23 years old, came to the United States, has practiced general surgery and thoracic surgery, chest surgery, from the time he came here until year 2000. So basically, he practiced for, 57 or 47 years up until he quit doing surgery in 2000. But then he continued on from 2000 to 2020 and just did a general practice. Did a general practice from 2000 to 2020 till age 90. He retired from work at about age 90. 67 years of practice of medicine. And with me, I've been in medicine since 1980, so I've got 45 years in healthcare. I was a respiratory therapist for a little while before I went to medical school. But between us, 45 years and 67, you're talking about, that's 127 years of practicing medicine. So we have this conversation at times about, when is the time to retire? And he's, I told him, I said, look, I'm approaching 65. I don't see myself working until I'm 90. I love medicine, but I love a lot of other things too. And I think he was a person who, like Dr. Bell and others, that was their main passion. I mean, my father told me one time, he said he'd do the work he did for free just because he enjoyed it that much. He didn't need to be paid for it. He'd made a living, and he didn't need money. But he's like, and he did. I think he actually did the last few years of his practice. I think he actually did, because he wasn't really that. He was never really business savvy. He was not. His generation didn't really. Most people didn't really think business-like. They just took care of the patients and let someone else worry about the business side of things. So he probably did lose money, but he didn't care. He enjoyed practicing medicine. And it's funny because he was only on a little bit of medicine for cholesterol. It's the only thing he was on. He was very healthy, and he was limping whenever he retired. He was limping, and his hip was bothering him. And I said, hey, you need to come down to Dublin. I can cure that. And he said, come down to Dublin, and I'll give you a cortisone shot in your hip and make you feel better. You know what he told me? He looked over his glasses at me and said, son, I don't believe in doctors. So he had a good sense of humor. But anyway, he worked a long time, and others have too. I don't know how many more years I'm going to work in healthcare, but I'm kind of like him. I mean, my motor's always running. I always want to be doing something. I always want to be involved. So, it's one of those kind of things where when you're passionate about it, you're really not. I don't have a hard set way of thinking about that.
Sure. Yeah. It's a calling for you.
Yeah, it is. I mean, some people, the modern argument is now that it's not a calling, it's a job, and that's I think that's it separates the people who really are committed from the people that are. I mean, if we're all just technicians and we're going to go work on the assembly line and use, which we're evolving now. We're using robotics for surgery. The other day, a surgeon did a surgery on somebody 5,000 miles away at another hospital, and he controlled the robotics and did the surgery. 5,000 miles away, he wasn't even there. So I guess he talked to the family on Zoom after he got done with the surgery to tell them everything went good. Yeah. How crazy is that? So things are evolving, but I mean, with everything that happens, there's going to be a positive and a negative. We have to try to cultivate the positive side and try to control the negative. There's a lot of people saying about AI that there's so much risk for AI to go bad and cause, and I think that's true. That's always been true. It took me a long time to get my first debit card because I didn't like the idea of the bank having control of my money and using the card and things like that. I like to have money in my hand, and but we've evolved. I'm not a Bitcoin fan. I'm still kind of not a fan of that. But the reality is, the world is evolving, and it's evolving in healthcare, and the people that are involved in healthcare, I think that they, even though we're not attracting the kind of people we once attracted in healthcare, I think that these people still have the ability to be fair and honest and do a good job. But it may feel a little different. It may look a little different than it did in the past. And I don't really know if that's a bad thing. It feels sometimes like a bad thing because we're hard set in our ways. But I think that the reality is that life is changing and the way people look at things changes. And so, just to give an example, a modern person might say, I don't care whether my surgeon's nice or not, as long as he does a good job and fixes me right. I mean, if he's a butthole, that's I don't care. I just want to make sure that he does a good job. Yeah. And so, there is something to that. May be a good point is that if you got somebody who's both really, really skilled and competent, but they're also really a good, decent, warm human being, then it's a double blessing. And but I don't know that that's always going to be the case. I mean, it's just we're evolving into where the mindset is very different now about these things.
Yeah, we'll see where it goes. But right now, we're proud to have you as part of our community.
Well, I appreciate it, and I appreciate the community, and I enjoy doing things kind of the old-fashioned way. I think that's what people around here respond to and they expect.
I believe it. Thank you, Doc.
Yeah.
Thank you.
Yeah.
Thanks for joining us right here on TV 35.
There's a new place for senior care, a place with 24-hour valet service and a boutique salon, a place with all-day arts and crafts. It even has a day spa, a place that's so much like home because, well, it is home. Home Instead Senior Care, when you need personalized care in the comfort of home.
Hi, this is Meg Greer Evans with Middle Georgia Estate Planning, and just welcoming you to give us a call at the office if you have any questions about long-term care, whether that be a trust or a will. We could also help you with a power of attorney or health care directive, and with long-term care needs for special needs individuals. We're here to help. Give us a call at 478-272-2885 or visit our website at www.middlegaastateplanning.com.